Hi, Mr. Smith. How are you?
Good, how are you?
Good. My name's Amanda. I'm going to be your nurse practitioner today.
Okay.
So what brings you in?
Ate something out of a food truck, and now my stomach has not felt right since. Experiencing some diarrhea as well.
Okay, uh-oh. When did you eat that food?
A few days ago.
Okay, like Monday?
It's today, Thursday, yeah, so probably Monday.
Monday evening then?
Mm-hmm.
Okay. What was the food truck? What was the type of food that you ate?
It was like a spicy, I think it was Tex-Mex.
Oh, yeah, sometimes that can upset your stomach, but I'll ask you some more questions and we'll kind of get to figuring out what's going on with you, okay? So is it just in your stomach then, or is it hurting anywhere else?
It's just the stomach area.
Okay. And how often have you had diarrhea since Monday night?
A few times a day.
Okay, a few times being 2 or 3?
Yeah, 2 to 3 at the most.
Okay, all right. And is it, so you're not having pain anywhere else, just kind of upset stomach area?
Yeah.
Okay, and does it come and go, or is it just is it always hurting?
It's pretty much persistent.
Okay. And is it like a dull pain, or is it ever sharp?
It's just a dull pain.
Dull aching kind of?
Yeah.
That tummy upset feeling? Okay.
Mm-hmm.
So have you tried anything to make it better?
Just some Pepto-Bismol, and that's about it.
And how often have you taken that?
Once a day.
Once a day, okay. And is it helping at all?
Kind of, but not really. It's still there after 3 days.
Okay, so you're still having this persistent diarrhea and upset stomach for about 3 days. Pepto-Bismol is not helping it. Is anything making it worse?
Not that I can think of. I've just kind of been staying away from the spicy foods.
Okay. So food, it doesn't really matter if you eat or if you have an empty stomach. It's still just constantly upset.
Yeah.
Okay. And do you have any other symptoms that you've noticed? Any fever or chills, anything like that?
No, none of that.
All right. Okay, Mr. Smith. Well, I kind of got a little idea about what's currently going on with you, but since it's your first time here, I'm just going to ask you a few questions about your past medical history and your family history and that kind of thing, okay? Feel free to answer yes or no or elaborate as much or little as you want. All right? So have you had any serious childhood illnesses like rubella or measles?
Pneumonia in high school.
Okay, and when was that?
In 2006.
Okay, and were you hospitalized for that?
No.
Okay, just kind of took some antibiotics?
Yeah, they just went to the doctor and they sent me home with a handful of things.
Okay. All right. Do you have any serious chronic illnesses like asthma or diabetes?
No.
Okay. Are you current on your immunizations?
Yes.
I know it's a little early to get your flu shot, but that's coming up here. So, any past surgeries?
Yes, my appendix in 2011.
All right, and how was that surgery successful? Were there any complications?
Yes, successful.
Okay.
No complications.
Great.
And a broken hand in 2015.
How'd you do that?
I punched a wall.
Uh-oh, what was going on there?
I was pretty blacked out.
Oh, drunk, huh? Were you in college then?
Mm-hmm.
Okay, were you in a fraternity?
Mm-hmm.
All right, so how much alcohol do you drink now?
Maybe once or twice a month.
Okay, and how many drinks per time do you have?
Maybe 10 to 12.
Okay, so, you know, it's fun to go out and party and everything like that. We always encourage people, you know, to try to keep it less than 10 drinks. That could be bad, but again, you know, it's a social thing, so I get it, and it's, you know, it's a safe place to talk about that here. Do you use any other drugs like marijuana or amphetamines?
Marijuana occasionally.
Okay. How often do you use that?
Maybe once or twice a week.
Okay. Is it a stress reliever for you, or just kind of a social kind of thing?
More stress relief.
Okay.
Anything.
Okay. Are you under a lot of stress right now?
No.
No. Job's good. Are you working?
Part-time.
Yeah. What are you doing part time?
Waiting tables and bartending at a golf course.
Cool. You like that?
Yeah, it's pretty nice. People are nice.
Good. Good. Well, we always like to discuss your goals and stressors at these visits, so it's an important part of your health as well if you're under a lot of stress. So, and that can actually contribute to some upset stomach symptoms too. So anyway, so work's going good. Are you in school or anything?
Taking a couple classes at UMKC.
Cool. I mean, you're liking it? School's going good for you?
Yeah, it's not bad.
Good. Good. All right. So you said you broke your hand. Have you had any other injuries other than that?
Nope.
No? All right. Are you taking any current medications?
Not at the moment.
No prescription meds or any vitamins or supplements?
Nope.
Okay. And do you have any allergies?
To the dye for the CT scans.
Okay. Gotcha. No allergies to medicines or food or anything like that?
Nope.
Okay. And at your job, are you exposed to sun a lot or any toxic chemicals?
No.
No? Alrighty. And have you ever served in the military?
Nope.
Okay. Alright, moving right along here, we're going to get into your family history assessment. So I'm just going to ask you if about some diseases and if anyone in your family, your parents, grandparents, siblings, if they've had any of these health concerns, then just let me know, okay? Coronary heart disease?
No.
No? Okay. High blood pressure?
Yes.
Someone did?
Yes.
Who was it?
I think my dad.
Your dad, okay. And was he, did he have any complications from that?
No.
He's still living?
Yeah.
Okay. Stroke?
No.
No. I'm just making some notes just so I can remember things for my documentation. Has anyone in your family ever had diabetes?
No.
Any obesity?
Yes.
Okay.
Got some pretty big cousins.
Some big cousins, okay. On both sides or?
No, just on my mother's side.
Okay. And how old are they?
30s.
Okay. Do they have any other health problems other than that?
I think it's just the big.
Just that they're
I
okay.
think they're just big. That's about it.
All right. Any history of cancer?
Yes. Grandpa on my mother's side had all the cancers.
All the cancers. Can you remember them off the top of your head?
No, I just know I think it started in his liver or prostate and just metastasized everywhere else.
Okay. I'm sorry. Is he still living?
No.
I'm sorry to hear that. When did he pass away?
It would have been last March.
Oh, I'm sorry. Were you close to him?
Pretty close.
Yeah. I'm sorry to hear that.
Thank you.
You doing okay?
Mhm.
Family's doing okay with the loss of him?
Yep.
Okay. Kidney disease or liver disease?
No.
Nope.
Other than the one cancer.
Okay. Drug or alcohol abuse?
No.
Okay. And any mental illness?
No.
Alrighty. So sounds like both your parents are living. Have any of your other grandparents passed away?
Yes, my other grandpa died of pneumonia.
And that's okay. Paternal grandpa, pneumonia.
Mhm.
And when was that?
That would have been April.
Oh, this past April. I'm
Mhm.
so sorry.
Yep.
So you've had some death in your family.
Oh yeah.
Oh. Well, have you been able to lean on your family and friends for some good support then?
Yeah.
Okay. Well, I'm sorry to hear about that, but I'm glad that you're coping with it and handling it. Okay, so just to get some demographic information, when was your date of birth?
Ooh, September 27th, 90.
Okay, and do you remember where you were born?
Des Moines, Iowa.
In Des Moines.
I believe that'll be Des Moines County as well.
Okay. And what do you consider your ethnicity?
White.
Okay. Occupation, we went over that. Working part-time at the golf course. Are you married?
No.
Okay, you're in a committed relationship?
Yes.
Okay. Do you have a girlfriend or?
Mhm.
Okay, how's that going?
Pretty good.
Good. We went over substance use. Do you smoke cigarettes?
No.
Have you ever in the past?
Yes.
Okay, how long did you smoke for?
It's just random bouts here and there.
Just kind of socially?
Yes.
Okay. Do you use any other tobacco products?
No.
Okay, have you ever in the past?
No.
No. Gotcha. All right. So for your nutrition, can you remember what you ate yesterday? Like a 24-hour diet recall?
Yeah.
Okay, so what'd you have for breakfast yesterday?
Breakfast had 4 eggs and a bowl of oatmeal.
Okay.
And then for lunch, I had chicken and rice
Okay.
and a protein shake. And then for dinner, I had the exact same thing.
Same thing as lunch?
Yeah.
Okay. Well, that sounds like a pretty healthy diet.
Mhm.
Are you getting do you eat a lot of vegetables usually, or?
About 3 or 4 servings a day.
Oh, good. Great. And do you have any financial concerns, any medical finance
Just
concerns?
Student loan debt.
Student loan debt. I hear you on that. And what do you do for fun?
Just work out, watch TV, read.
Cool. And how often do you work out?
4 times a week.
Wow, good for you. That's great. What do you do when you work out? What kind of exercises? Like weight bearing or cardio?
Weight bearing.
Okay. Have you had any injuries related to that?
Yeah, I tweaked a muscle in my back
Okay.
2.5 weeks ago.
Okay. Is it still hurting you?
No,
That kind of resolved on its own? Okay.
just ice and heat.
Good, good. All right. Are you experiencing any domestic violence or physical abuse?
No.
Okay. You feel safe at home?
Mhm.
Alrighty. And went over your goals. And all right, so now we're just going to go over a brief review of systems. I'm going to touch on each body system briefly and just ask you some questions related to that body system. But we'll really focus in on your the GI symptoms that you've mentioned. We'll focus in on that with the abdominal exam, okay?
Okay.
All right. Have you had fever, chills, or night sweats?
No.
All righty. Any weight loss?
No.
All right. Have you noticed a change in your skin, hair, or nails?
No.
No change in color or texture?
Nope.
Have you had a sore throat?
No.
Or any bleeding in your gums, change in taste, anything like that?
No.
Have you had a runny nose?
Not recently, no.
Not recently.
No.
When was the last time you had a runny nose?
July 4th.
July 4th. Well, that's a good specific date there.
Yeah, it'll ruin a holiday.
I guess that's one way to remember it. All right. Have you had any changes in your ability to hear?
No.
Any ringing in your ears or anything?
Nope.
Okay. All right. Moving right along. Any changes in your vision?
No.
Any blurred vision or double vision?
Till 2020.
Great. When was your last eye exam? Hard to remember. It's okay. Don't worry about it.
Definitely last year.
Okay.
Sometime in 2017.
Gotcha. Are you having any difficulty breathing?
No.
Any coughing or shortness of breath when you're exercising?
No.
Have you had any heart palpitations, like a racing heart?
No. Unless I was exercising.
Okay. And have you noticed any swelling in your hands or feet?
No.
Or any tingling or numbness in your hands or feet?
No.
And have you had any weakness?
No.
Or,
Other than like when I tweaked my back muscle, then it was kind of
sure.
weak, but no.
Okay. And we went over your GI symptoms that you've had. Are you any changes in how frequently you're urinating?
No, I'm still going 6 to 8 times a day.
Wow. How much water do you drink?
A lot.
Okay. Can you estimate how many glasses?
A gallon, probably 128
Oh,
ounces.
wow. That's great. Good to be hydrated.
16 glasses, if you...
Nice. That's some good math right there. Better than I could do. All right. So now we're going to get into kind of the sensitive genital area. Are you having any issues with your penis or testes? Any pain?
No.
Okay. Do you have any concern about sexually transmitted diseases?
No.
Okay. Are you currently sexually active?
Yes.
All right. Are you using contraception?
No. Or birth control. She is.
Birth control. Gotcha.
There's no birth control for men yet.
Yeah, I think that's coming our way soon. Okay. Have you noticed any bruising, excessive bruising, or excessive bleeding?
No.
Okay. Any swollen lymph nodes, like under here, under your armpits?
Nope.
No. Any changes to your mental status? Getting confused?
No.
Any changes in your mood?
Nope.
Or loss of interest in things that you normally like?
Nope.
All right. And have you had any allergic responses, like a rash or hay fever?
No.
All right. Okay, well, Mr. Smith, we're done with our interview portion, and we'll move on to the abdominal assessment. So I'll give you a minute to get changed and get on the exam table, and I will be back shortly.
Okay.
Okay. Knock, knock. Hi, Mr. Smith.
Hello.
I see you're all ready to go for your abdominal assessment.
Yep.
So the first thing that I'm going to do, I'm just going to inspect your abdomen. I'm just going to look for any masses or any asymmetry and anything like that, okay?
Okay.
Okay. Okay, now I'm just going to take a listen to you with my stethoscope. I'm going to try and warm it up first so it's not super cold.
Thank you.
You're welcome. So I'm just going to be listening for your bowel sounds, and I'm also going to listen to your renal and your aortic arteries that are down in that region as well. Okay. And so now I'm just going to do a technique that we call percussion, and I'm just going to tap my finger on your abdomen and listen for the sound that it makes, okay?
Sure.
And now I'm going to do a technique called the liver scratch technique. It's just done to assess your liver span to see how big your liver is, okay?
Okay.
So I'm just going to be scratching my finger on you. Is that all right? Not very hard, just very lightly.
Sure.
Okay. next thing I'm going to do is I'm just going to do some light and deep palpation. So I'll just be pushing on your abdomen. Do you have any areas that are sore or tender right now?
Just my right around the navel.
Around the navel. Okay. Well, I'll try to avoid that area right now. I'm really just trying to feel around to see if I can feel any masses or anything like that. So I might have to get close to that area, but I'll try to keep that to the end.
Okay.
Okay? Does that hurt?
No.
Okay. Let me know if you have any tenderness in any other areas.
Okay.
Okay, now I'm going to go a little deeper. Having any tenderness? Any pain?
Not in the upper area, no.
Okay. But you are having some tenderness kind of down here?
Yeah.
Okay. All right, well, I'm going to try and palpate your liver, spleen, and your kidneys.
Okay.
So first I'll start off with your liver. So I'll just have you take a deep breath in. And out. Okay. And now I'm going to do your spleen. So I'm going to pull on your rib cage a little bit. Okay. And now for your kidneys, I'm going to put this hand underneath you, okay? And just go ahead and take a deep breath in. And out. Okay, I'm going to do your other side. Deep breath in. And out. Okay. Well, Mr. Smith, I don't feel any masses or anything like that, or any abnormal pulsations. I would recommend, like you said, to avoid spicy food. That seems to be kind of a trigger for your GI system, like you mentioned earlier.
Okay.
I'm wondering if maybe you've experienced some type of food poisoning. But since your diarrhea has been persistent for so long, I am going to recommend that we get a stool sample here and send that to the lab for some testing. That way we can see if maybe we need to get you set up with some antibiotics or anything like that. Again, it's great that you're drinking a lot of water. That's really important when you're having diarrhea because your body can get dehydrated easily.
Okay.
So we'll just send down a few tests to the lab and look at those results, and we'll get you set up with some treatment, okay?
Okay.
Is there anything else that you wanted to discuss?
Nope, that's it.
That's it? Did you have any other goals in mind for this visit?
Nope, just kind of get the diarrhea under control.
All right. Okay, well, thank you for coming in. It was really nice to meet you.
Likewise.
Okay. Mr. Smith is a 27-year-old Caucasian male who appears to be his stated age, presenting with symptoms of GI upset stomach, abdominal pain after eating at a food truck on Monday night. He was alert and oriented. He was cooperative and appeared to be a reliable historian. There were no other people present in the room. And his abdominal exam revealed slight tenderness around the umbilical region. On inspection, his abdomen was flat, soft. I did not see any noticeable masses or obvious pulsations. His abdomen was symmetric, and his umbilicus appeared to be intact, with no obvious lesions or bruising or lesions noticed. His bowel sounds were active in all 4 quadrants, and I did not hear any bruits when I listened to his renal or aortic arteries as well. Percussion revealed tympany on most quadrants except for over the liver and spleen. The liver span appeared to be around 10 centimeters using the liver scratch technique. Light and deep palpation did not reveal any masses or any extreme tenderness except for, as the patient had previously stated, around his umbilical region. I was not able to palpate his liver, spleen, or kidneys, and I recommended to the patient that we do send down a stool sample in the event that he did experience some type of food poisoning, and due to the frequency and duration of his symptoms of diarrhea, and recommended adequate hydration. He appears to be well hydrated. His skin looked intact, did not seem dry. So we are awaiting those diagnostic tests, and based upon the results, I will recommend a further course of treatment.